A lot of people think that hospice is somebody passing, within days, but really there's a lot more time where we get to build those relationships with people and we get to show families, make good memories their last days. The main goal of hospice is overall comfort, and it's looking at quality of life and not the quantity of life. So making sure that patients are comfortable and then finding what's important to them. At the end of life, it's hard because our patients can't talk to us. Most of the time we're there, even if they're in and out of responsiveness. I did have a patient who woke up and just told me what a great job I was doing. And so it was just good to know that they know what we're doing even when they're not responding to us. My name is Emily Stoddard. I'm a registered nurse case manager for CorsoCare Hospice. So when I first started, I was just a med-surg nurse, and then I transferred to Sparrow where I worked on an oncology floor, and we got all of the end-of-life care patients, and that's where I found that I really enjoyed taking care of that population and talking with their families and educating them. I visit patients, I take vitals, I can ask them questions if they are able to respond, or I'll ask family or their caregivers just to make sure that they don't have anything that needs attention or medication changes. So that's a basic day. You never know when somebody's going to pass, so your caseloads can get quite high and that can get stressful, but knowing that I have other coworkers, we have a partner in the building, so in that way if I'm not there, I always have help. Actually, one of our last days we had a guest speaker, and he was a hospice nurse, and he just talked about his experiences. That was just very eye-opening that maybe that was something that I wanted to do. But in nursing school, we don't talk about death as much, as we talk about trying to help people to get better. So I think, listening to him and how he turned something that's usually a negative into a positive really influenced my reasoning for going into hospice.